One reason we're really running out of these kits is that people are just panicking. I've never had a test. I've never had any reason to think I needed it. But people who, such as I, go get them just to make sure. Please tell us who needs to be tested and who does not. What would be a trigger?
I think one of the things you obviously look for is what kind of exposure have you had. Do you know that you've had an exposure to a positive case? And that's one that you certainly watch symptoms. And the next thing you have to ask yourself, if you've had an exposure, have you been fully vaccinated, as the doctor said, meaning also with booster. That goes into isolation and quarantine, and I could talk about that just a little bit, the difference in those terms, even though they're used so many times interchangeably. Isolation, means you're ill. Quarantine means you've been exposed to the virus. But back to your question, which was? How do people know if they should be tested? Like, I'm not going to go be tested because I have no symptoms. I guess if I were around somebody, you're saying I might want to consider being tested? I think if you were in a typical call I would get would be a daughter has come home positive. She lives in the household with the parents, and they've been around, and she just tested positive yesterday. I think they obviously need to look at their vaccination status again, look at whether they develop symptoms, and we all know that you can be asymptomatic, especially with Omicron.
So they would wait a few days?
Wait 5 days at least, and test and get a negative and feel good about it. One of the valuable things...
But protect yourself from infecting other people in case you are contaminated.
Exactly.
Right?
Wear a mask, stay quarantined. One of the new CDC guidelines on this, though, if you're fully vaccinated, and I won't keep saying and boosted, but fully vaccinated, if you've been in contact with a positive case, you do not have to stay at home, but you do need to wear a mask when you go back to work, monitor your symptoms, see if you do it, and it'd be great to test at 5 days to see if you can get that confirmation that you're negative.
Okay, I just want people who need the test to have them, not just general people who are panicking all the time wanting to know what their status is.
Yeah, there are a number of people that have had multiple tests because of any kind of symptom that might come along. And I think, again, the exposure, all of these symptoms, these telltale symptoms that we talk about, whether it's fever, even headaches, even lower GI with some of these issues, but the sore throat, the congestion, and you would hope at this early stage it wouldn't go into lower respiratory issues at that point. And we haven't seen that with this strain as much as you were talking about. The acuity of this particular virus has not been as extreme as with what we experienced with
more
Delta.
flu-like headaches, and upper respiratory.
Highly transmissible, but just not the severity that we saw with Delta.